So when we've had a chat and decided that a knee replacement is the right way to go, there's a process that you're going to go through and a journey that you're going to go on with us. And the first thing we're going to do is we're going to do a pre-assessment clinic. We like to do that roughly a week, 10 days, within 2 weeks, but not too close to the operation, because we're going to talk to you about, you might be on blood thinning medication, for instance, and we're going to want you to stop that at an appropriate time. And it varies whether it's aspirin or one of the other drugs, so that you're off that medication before the surgery. We may want to take some wound swabs and swab you to see if you're carrying bacteria, or take a urine sample. So there's lots of things we'd like to do, and we'd like, including a blood test, and we'd like to do that at a stage where we can actually do something to make sure that your surgery isn't delayed. So that's the pre-assessment clinic. If you have comorbidities, you've had a heart attack, you're diabetic, there's other things going on in your medical world, then the anaesthetist may get involved and speak to you directly. But the anaesthetic team have set up the pre-assessment clinic, and the idea is to identify patients that are at a higher risk, and in certain circumstances there'll be a direct interaction between one of our anaesthetic team and you before your surgery. But most patients meet the anaesthetist on the day of surgery. Then we want you to come in on the day of surgery. If it's a morning list, then we tend to see everybody at 7 o'clock, because that's when we do our ward round, and then we go to theatre. If it's an afternoon list, we tend to see people around midday. It's really important that you haven't had anything to drink for 2 hours before the surgery. So if it's a morning list, have your last glass of water at, say, 5 o'clock, maximum 6 o'clock in the morning, and then stop. And don't eat any food for 6 hours before the surgery. So early breakfast if you're on an afternoon list, the night before, or up to midnight if you're on an AM list. So only water, and that's within 2 hours of the surgery. Otherwise, nothing else, no tea, no milk, no milky tea, no milky coffee. It's just water for 2 hours leading up to the time of your surgery. If we're doing an all-day list and you come in at 7, obviously we're not going to keep you without water all day, and we will give you water until an appropriate time to keep you hydrated. That's important, of course, for making sure that things are optimized for the operation. Then we're going to do a ward round, and you're going to meet one of us. So we're going to come and draw a big arrow on your leg to indicate the side that we're going to operate on. Obviously, people laugh at that. It's part of the process of checking and double checking. You'll meet the anaesthetic team. You'll meet the nurses on the ward. You'll be put into a gown. And then you'll be taken upstairs to the anaesthetic room, where you'll meet the anaesthetist again with his team, and they'll start the anaesthetic process. And that'll either be a spinal anaesthetic, like a pregnant lady's epidural, where everything goes off to sleep below the waist, or it'll be a general anaesthetic, or a combination of the two. And that discussion around what anaesthetic am I going to have, that's really between you and the anaesthetist, and it's a decision that you both make together. Then we bring you into the operating theatre. It takes us about 15 minutes to set you up for the surgery. Obviously, you're asleep at this point, or certainly your legs are. If you are having a spinal anaesthetic, normally people opt for sedation, so effectively you're asleep. And we position you on the table, ready for the operation, and then we get going. Surgery takes anything from 40 minutes to an hour to do the knee replacement, and then we put the bandages on. Ideally, we put your cryotherapy device on. We work with a company called Physiolab. We want you to rent one of those before the day of the procedure and bring it with you, so we can put your wrap on your leg as part of your dressings. That means we can get the cryotherapy going within the first few minutes from when you wake up, and that's important to minimize pain. The anaesthetist is going to give you drugs before, during, and after the operation to minimize your discomfort. Now, when you wake up, you should have no pain or minimal pain following this procedure, because there's a formula that we're following. So it's the anesthetic input, it's the local anesthetic blocks that we put in as part of our procedure, and it's the medication that you get immediately after the surgery from the anaesthetist, and of course, one of these cryotherapy devices, which is really quite crucial. So pain now is not what it used to be with knee replacement surgery. We've really got it down to a very low level of discomfort in the vast majority of cases. Then you'll wake up in the recovery area, and the recovery nurses will make sure that you're ready to go down to the ward. That whole process probably takes about 2 to 3 hours. So your other half, your family, anyone that's with you, will need to know that you'll be gone for a few hours. And then you're brought back to the ward, and we start the process of getting you back on your feet. And the physiotherapist will help you on the day and the day after to ambulate you and get you going such that you feel safe and secure. Most patients will use 2 crutches initially and for the first 2 to 3 weeks, and then get down to 1 crutch and then get off their crutches by about 4 to 6 weeks, something like that in terms of the walking with crutches and timeline.